Now, for the next set of investigations which we'll be looking at, um, is specific investigations. So, specific investigations for gynecological conditions. Do you understand? So, we looked at the general investigations. You understand, where we're talking about those history taking, physical examination, complete blood count, urinalysis. Those ones are kind of like general investigations. You want to actually dictate a broader range of issues. Do you understand? So as related to the gynecology, that's like issues related to the gynecology. Okay, so if you want to actually dictate specific issues as related to gynecology, that's like the reproductive system of women, you might actually want to do some specific tests too. Okay, so these tests, let's look at some of them. Of course, we are not going to discuss in depth on any one of them. We're just trying to just name them. Then later on we'll come back and talk about them. So to investigate, we said that if you want to be more specific, you have to tailor your diagnostic test, okay, based on what you got from your physical examination, also based on what you got from your history taking. Okay, so things like what if there's abnormal uterine bleeding, that you picked up that the woman is just bleeding in between periods and all of that, you might actually want to do transvaginal ultrasound, you want to do endometrial biopsy, hysteroscopy, hormonal assay. Okay, if there's pelvic pain, if she's feeling pain from the stomach down to the reproductive system side, pelvic ultrasound, laparoscopy, STI screenings, urinalysis, then you culture to see if there's any possible microorganism that is causing issues for this person. Then infertility, hormonal profile, so follicle stimulating hormone, luteinizing hormone, estradiols, prolactins, thyroid stimulating hormones, all of this should help. Then hysterosalpingography, transvaginal ultrasound, semen analysis. Of course, if there's issue of infertility, you don't just checkmate only the woman, you also checkmate her partner. They track the ovulation. Okay, then if there's vaginal discharge, you do wet mount, okay, microscopy, you want to identify the microorganism causing the issues. Vaginal pH testings, cultural sensitivity, also you want to identify the organism. There also nucleic acid amplification test, you want to actually still confirm the organism. So you can see some of them: endometrial biopsy, transvaginal ultrasound, dilation and curettage. So suspected malignancies, pap smear. Then you also try to check if there's human papilloma virus. They're called colposcopy, biopsy. Okay, then CA125 blood test, MRI or CT scans. Okay, so this is hysteroscopy. You are trying to visualize, the uterus. Okay, I can even use it to do some 1 or 2 surgeries. Okay, then menstrual irregularities, I'll check out for thyroid hormones, prolactin. That's a hormone that is basically inducing breast milk production. I'll check out for androgen levels, pelvic ultrasound. Then postmenopausal bleeding, transvaginal ultrasound, endometrial biopsy, then hysteroscopy. Okay, so key diagnostic procedures, we spoke about them though. All right, but these are the key ones. These are the key ones, right? So you can pause to actually look at their names and also look at their purpose. We listed a lot of them, but these are the most commonly used ones around. Okay, so that's it for this.